Good afternoon, good morning, good evening, wherever you are from the world. My name is Dr. Becky Coots-Kimbley. I am a traditional naturopathic doctor as well as a functional medicine practitioner. And I'm currently in school right now working on a PhD in natural medicine. For those that don't know, I've been heavily involved with the AO scan since 2020. I do a lot of education for the scanner. I've created a gut course for Solex, which can be found in your back office at Solex University. My big thing that I do is a 6-month group gut program. I also still do a 1-to-1 group gut program. So gut health is pretty much what I do. The whole entire program and protocol is not just about the gut, but we are looking at physical things that are going on, physiological things that may be going on, and then we also address the emotional and the limbic aspect and working on beliefs. So it's an all-encompassing program. So a lot of the education that I have in a lot of my courses and in the Solex course is a lot of that. I pulled a lot of that from that. So it's not all just about gut health. I myself have recovered from chronic Lyme. I've had 2 Lyme flares. The last one was in 2019, getting ready to go to the second stage in the CrossFit games for the Masters. And then we had COVID. So, and I almost lost my practice on top of everything because, in the state of Pennsylvania, I was shut down for many, many months because of COVID. So the AO scan just happened to fall into my lap, which opened up a whole other world of how to work with clients globally. I am the owner of Kimbley Quantum Collective. I have 3 other practitioners who are working with me, and we all use the AO scan, and we all work with people all over the world. The crutch of my people have had Lyme, mold, autoimmune issues. I look at genetics. I look at liver and detox pathways. I look at methylation and all that stuff. So there's a lot of different things that you can utilize with the AO scan device. It's simple, it's easy to use. You can have, again, fabulous information just at the palm of your hands. You don't have to wait for lab work. I use it with my structural clients when I have to do if I wanted them to possibly get an X-ray or a CT scan of a certain area, I can look at what the scanner tells me at that area. So it's definitely quick and easy and really easy feedback for the average person to use. So this presentation is about AO food sensitivities because we do have a whole entire section in the vital scan just on food sensitivities. You do not have to run the whole entire scan. You can select and pick and choose which ones you want to run. So if you just want to do a quick food sensitivity assessment and kind of see can I eat this food today? What's going on? You can just select that. So AO food sensitivities, that's what this is about today. Now, remember, because this device is not diagnostic, it's for education, okay? It is for educational purposes only. So we are reading energy and frequencies. Something else I'll tell you, because most people don't understand this either, is when you get lab work done, it's going to change in a couple hours. It's going to change in a few minutes. We are constantly in flux. Blood's moving, energy's moving. I like to use the analogy of when you stick your finger in a stream, bring it out, put it back in again. There's different water going through. Blood work's going to be the same way. So when you get labs done, 2 weeks later, you get to your doctor, they're already old. What kind of good is that? So now they're reading labs that are 2 weeks old. Your body is already changing. Okay. Another reason why I like using this device, because every time you scan yourself, you're going to see exactly what your body needs right at this time. Okay. So again, we are talking about frequencies. Your frequencies can appear in your scans. So when you're reading your scans, start thinking about not diagnostic, not blood work. Things are not written in stone. Okay. Frequencies can be cell memory, residual toxins, and actual currents, residual inflammation, damage from prior exposure. Could also be the closest frequency of something that is not in the database, because there is a lot and not everything is registered, which I see a lot with parasites, which I'll get to a little bit later. Shedding from live vaccines from others around you. So yeah, that's a big thing right now. It's a big area that I've been focusing a lot in on, because I can see on my end what's happening with people who've been vaccinated, who've not been vaccinated, and just who've had COVID. It almost looks the same on my end. So trying to figure out, like, how can we start pulling this out of people the best that we can? So that'll be another Zoom. Why do food sensitivities show? Now, again, this is a sample clip of just one of the items that you can see in the food sensitivities from the vital scan. It's best to be run in the classic view. You're just looking for the red and the green dots. If something is a double red, you definitely want to take it out for a period of time. Now, because it is frequencies, you are going to start to see things shift and change as you start scanning day in and day out, because it's trying to optimize your body. Okay. Sensitivities could appear because maybe you have leaky gut. Maybe you're under a lot of stress. Maybe you need a chiropractic adjustment in the lumbar spine, because that can affect the gut. Again, remember, it's frequencies, it's not diagnostic. It could be picking up some of the pesticides, herbicides, and insecticides that you're eating. If you're never eating those foods, it could be just a frequency that the brain is tagging. We can look at emotions. We can look at the environment, infections. This is why your scans are going to look different daily, especially with a lot of emotional stuff going on. It could also be a problem food, or you could be eating the same foods all the time. So if you're like eating pineapple 5 days in a row, pineapple may show up as a double red in this category. Okay. Other reasons why it could be a similar frequency to another food, like gluten reactive foods such as oats and quinoa. It could be an inherent insensitivity. So this is where you get into miasms. It's just energy, and it just may not work for your body at this time. You could eat the food and see if you're sensitive to it, because it's going to show up right after you eat it. So I kind of did this with eggs. I didn't have eggs for many, many years. I could only eat duck eggs. And then once I got the device and started scanning myself, I started noticing that eggs weren't double red all the time. They might be red and then green, red and then green. So then I would try eating a little bit of an egg and just seeing, does it go green? Does it stay red? So over time with me scanning and optimizing, it just started being green all the time. So then I started eating eggs. If I do eat too many eggs, though, it will pop up as red. So I just know I can't eat eggs like 7 days a week. Some of the items that are coming up may be because your body is actually needing them, which is kind of like a mind bend for a lot of people. But I have seen that, and I'll explain that as I get a little bit further down. A lot of people will scan before they eat, just to see, like, can they eat this right now? Do they need to hold off? You can also compare with what you're seeing with inner voice and body systems for the emotions. And again, you're looking for trends and patterns. Nightshades. Most people know what nightshades are. In my autoimmune gut program, nightshades are a food category that we do remove for a particular amount of time. They are inflammatory, especially for people who have thyroid issues, autoimmune thyroid. So just some of the nightshades when you're looking at your food scans, you know, we have tomatoes, we have potatoes. Sweet potatoes are not a nightshade. We have eggplants, your peppers, tobacco, goji berries, ground cherries, and ashwagandha. This is why sometimes this does not work for people if they need, you know, some type of adrenal supplement, because it is a nightshade. So you're taking something that you think is good, but it actually could be triggering and making that person worse. People with inflammatory and autoimmune diseases typically don't do well on nightshades. People with heartburn and GERD will typically react to these foods. A lot of times in the scan, in the vital scan, when you go down a little bit further, you will start to see tobacco and nicotine showing up. That could be, again, from the nightshades. Check your inflammatory markers in the inflammation category. And you can also see if you're working with someone who has a lot of joint pain and osteoarthritis, if those symptoms don't disappear, you might want to remove the nightshades, okay? Overconsumption of nightshades can lead to calcium deposits in the soft tissues. So again, like tendons, ligaments, kidneys, can also lead to coronary artery disease, calcification of the kidneys. These foods in the gut protocol are typically going to be removed for about 6 weeks, give or take. Again, we monitor people's symptoms, and as their symptoms start to lessen, we can start playing around with adding some things back into the diet. Nutrient deficiencies can make sensitivities worse, like magnesium, vitamin D deficiency, and if the liver and the kidneys aren't detoxing well. Histamine's another big one. Histamine's something that I've been seeing an awful lot of, ironically, around COVID. I don't know if there's a connection. But there's lots of fruits and vegetables. So this is where in that fruits and vegetables category, you can start looking to see if they're all, if there's a lot of histamine foods showing up, you probably need to take histamine foods out. You can then confirm when you get down a little bit further in the liver and gallbladder section. If you see a lot of liver markers coming up, in the inflammatory section, we have histamine and homocysteine. So see if histamine's showing up. If you're getting a lot of yeses for all that, you probably need to consider taking some higher histamine foods out. So dairy is one of those foods. We also have bananas, strawberries, avocados, pineapples, citrus, spinach. And what you're going to start to see is a lot of these foods are repeated in a lot of the different categories. So we already talked about tomatoes and eggplant in the nightshade category. Now you're seeing it again in the histamine category. Sweet potatoes we talked about were not a nightshade, but they can be a high oxalate food, as are spinach. So you're going to start to see that repeating pattern. So I know a lot of times people like, okay, I'm taking all these foods out, what's left for me to eat? Because it is such an issue sometimes as to what is left for you to eat. A lot of times I will look at what are the foods that are the most obnoxious that are showing up in all these categories that you're having issues with. Well, let's take those out first, okay? So you don't get so overwhelmed. I already kind of talked about this, other things to look at for histamine on the scanner. If there's high histamine, people have issues with methylating usually. Like I said, check the liver and detox phases, check to see if they have MTHFR. Omega-3s, IgE is going to be mast cell and histamine. Basophils are your white blood cells. B vitamins are usually going to be an issue. Vitamin D, zinc, copper, and mag. So those are just some of the things to kind of look and check off that box of like, yep, histamine, histamine, histamine issues. Here we go again. So we already kind of talked about oxalates briefly. So oxalates can actually cause a histamine release. So there's a lot of sometimes digging you have to do with people because it's like, is it really a histamine issue? Is it an oxalate issue? Is it a reaction to sulfur? Because a lot of those kind of look the same. Again, check to make sure that person doesn't have a B1 deficiency. Foods to inhibit histamine, watercress and onions. Onions have been shown to inhibit that histamine release. And can help stabilizing mast cells and lower histamine. Quercetin is found in onions. Also the same thing, effective mast cell inhibitor. Chamomile, nettle, apples, peaches, Brazil nuts. Those are all things that can inhibit excess histamine. Stress causes high cortisol, which causes a high sympathetic tone. So now the nervous system's upregulated, and a low parasympathetic tone. The high cortisol and the imbalanced nervous system creates an immune imbalance and then can increase histamine. Excess histamine is going to open up the gaps between the cells in the gut, and then this is another reason why people get leaky gut. So there's many different reasons why people get leaky gut. It's not just gluten, it's not just glyphosate. Oxalates. So we already talked about spinach and sweet potatoes. Some other high oxalate foods are going to be rhubarb, rice bran, almonds. Some lower Oxalate foods are going to be your grains, potatoes, beans, sunflowers, cocoa, beets. Even though beets are great for the gallbladder, sometimes with oxalate issues, it doesn't end well. If, again, for the scanner, if you're looking for oxalates, look for those foods and then go down and check the kidney section. If there's a lot of markers showing up in the kidney section, you might want to suspect oxalates, as well as candida and aspergillus. Can't talk today. Gallbladder food. So this is another thing I'm seeing a lot of: sludgy gallbladder, sludgy bile all of a sudden. Some of those foods you're showing that are showing on that scanner may actually mean that you need some of these gallbladder foods, okay? So avocados, olive oil, grass-fed butter, wild-caught fish, beets, radishes, celery, even though celery is high histamine. So again, you have to like, do I need it? Do I not need it? Is the benefit going to be there? Artichokes, lemons, limes, grapefruits, cucumbers, carrots. Those are all really good gallbladder foods. Consuming broccoli and kale sprouts, increasing your fiber with pumpkin seeds, chia, flax seeds, and hemp. Other markers you can look at on the scanner would be your lipids and your cholesterol. Usually those are going to be an issue with people that just have issues with their gallbladder. HCl, stomach acid, super important. Stomach acid does like 1,400 different things in the body, and most people are low and deficient in it. Look for amylase and the lipase enzymes, bile acids, your liver markers, bile secretion function, bilirubin, which will usually be elevated, so you may possibly see a lot of 9s, total bile acids, total bilirubin, and white blood cells. Those are all other markers that you will see in association with issues with the gallbladder. Sulfur foods. We have garlics, leeks, onions, scallions, eggs, chicken, milk, almonds. Those are a lot of high sulfur foods. A lot of people have sulfur intolerance. There's a lot of, like I just said, there's a lot of symptoms of sulfur intolerance that often overlap with histamine intolerance. Sulfur is present in the 2 amino acids methionine and cysteine. Gut dysbiosis, you're usually going to see. Molybdenum can help metabolize these sulfur amino acids. Sometimes people have issues clearing sulfur because of genetics. So if I keep seeing that showing up with methylation issues, then sometimes I have people get genetic testing done. There is a strong correlation between heavy metal and sulfites. I already kind of talked about checking the detox phases, primarily sulfation. And then with methylation issues, you're going to see issues with metabolism of these sulfur amino acids. There are a lot of common gluten cross-reactive foods: buckwheat, eggs, soy, dairy, coffee, oats. This is why a lot of times we take a lot of those foods out, because the brain and the body just thinks it's getting more gluten. So in order to calm down that overloaded, stressed out, toxic bucket load, we need to try to remove as much inflammation as we can and give the body time to recalibrate. A lot of the items in the seafood category could be coming up because of a shellfish sensitivity. So if you're seeing squid, oysters, lobster, crayfish, that kind of stuff, you might want to think about that. Peanuts, corn, wheat, barley, cocoa, tree nuts, rice, beer, wine are going to be all mycotoxins. So now we're talking like dampness and mold, which we don't want in the system. So we would typically avoid those in addition to coffee, especially if someone has a lot of mold in their system or adrenal issues. Mushrooms are also going to be a fungus, which can contain mold. So they are typically removed initially too. Methionine, sometimes people need to be on a restricted diet for that. You know, again, it depends on how they're methylating, how they're processing foods. Sometimes with that MTHFR variant, they need to restrict that. Methionine is an essential amino acid. It cannot be produced by the human body, so it must come from food. Some need to be on a restricted diet, like I said, because of inherited disorders or because of excess homocysteine. Methionine is the precursor of homocysteine, which again is a sulfur amino acid in the methylation and sulfation pathway. I just realized I spelled that wrong. Excess dietary methionine and B vitamin deficiencies, B12, 6, and 9, can elevate homocysteine. When homocysteine is elevated, then you're going to have a lot of inflammation in the arteries. So you might see a lot of artery stuff showing up in the head, and then can also increase the risk of forming blood clots. Cilantro, you might see that showing up because maybe you need that to detox from heavy metals. There are a lot of foods that are anti-parasitical too. We have clove, oregano, ginger, kelp, horseradish, black pepper, peppermint. You've seen a lot of those foods coming up. You may actually need them. The other thing that's really cool is if you go down to the parasite section, and if you're seeing a crap ton of parasites show up and low stomach acid, you probably need stomach acid. When you start eating and secreting the juices and enzymes, actually your mouth is where you start breaking down any type of pathogens that you might inadvertently been eating. So low stomach acid can rectify a lot of those parasites that you see showing up. Some of the gut healing supplements, you might see licorice root, aloe vera, peppermint, fennel, ginger. We actually use those to heal the gut too, in addition to glutamine. Beans and nuts can be showing up just because someone has a lot of gut issues and they're just not digesting and breaking all that stuff down well. Some other items that are random, we talked about cilantro for heavy metal detox. Cloves and oregano can both be used as an anti-parasitic. Coffee could be showing up because of mold. Kelp could be showing up because that person needs iodine. Beef could be showing up because maybe that person needs beef liver. It is rich in copper and iron. Broccoli could be appearing a lot because maybe that person needs sulfur-rich foods. And then we talked about all the gallbladder-friendly foods. So that's a lot of data and information you can get just from the food sensitivity section. If you've never had an AO scan done, you can email me at kimbleybodywork@gmail.com, or you can go to kimbleyquantumcollective.com and you can schedule an appointment. We can get you going. Like I said, we have 3 other healthcare practitioners. We have 2 naturopaths of functional medicine. We have holistic health coaches. We've got people who do quantum neurology. We do DNA, which is dynamic neuromuscular assessment. So there's a lot of help for the masses out there. There's a lot of people who are struggling. Conventional medicine has failed them. They've been around the block. I was one of those people. So what our mission is we try to educate people and empower people to learn about their bodies and their health, and to take their health back. If you're waiting for someone to fix you, it's not going to happen. You need to learn how to do this stuff on your own. And that's what we do. We help you get comfortable with your body, understand what it needs. And that's a lot of the teaching that we do. So thank you so much. If you have any questions, get a hold of me. Like I said, I have courses in the AO scan. I do one-to-one mentoring. So if anyone needs anything, you know where to find me.